Welcome back to the Balance Mama Project Radio, where science meets soul and motherhood. Today, we're talking about one of the most important and often overlooked decisions in your pregnancy journey. So, choosing the right birth provider. So, whether you're seeing an OB-GYN, a midwife, or a doula, the person guiding your birthing experience can definitely shape how empowered and calm and respected you feel. So, Val, let's talk about what to look for so folks can walk into labor confident and relaxed. Because we want the providers to be partners, not directors. We want the mamas to be the decision makers and have their choices supported and well informed.
Absolutely. You know what? So funny. We definitely, Dr. Saiah, we forgot to say, like, if a physical therapist is
Oh,
on your
yep.
team too. But
Yes.
I think that's absolutely why we're here because not a lot of people know that we can also support with labor and delivery. So yes,
That's so true. Come on, pelvic PTs. We're out here.
we're
We
doing
are
it.
out here.
We're doing it. So, we definitely want to talk about this important topic because um, a lot of times people feel like, you selected your provider and that's just who you have. And even if it's not a good fit, you still got to go with it. So, we're going to talk a little bit more about what to look for and, what your choices are, what your options are. So, let's get into it. Let's first talk about autonomy. So, this word often gets thrown out a lot, but it really is autonomy is about having agency and choice over your body and what interventions or what treatment or what happens to your body as you're going through medical procedures and your birth experience. So having the option to choose what happens and determine your outcome or determine your situation. So basically, what we want to get at is there is a real difference between having a provider who is caring for you versus having a provider who is directing you. A lot of times, I mean, I've been in, I don't know, Dr. Say, you probably have too, but I've been in medical offices where a provider will literally say, okay, so we're going to do bop, 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 bop. And there's no room for me to say like, I feel uncomfortable about that, or tell me more about that. It's just a period, point blank, end of
Oh,
story
yeah.
statement. You know what I mean? So that's something that is, now that I'm a provider and now that we advocate for people about this, it I'm really able to be like, wait a minute. What are my options, right? So I want to be cared for. I want to be consulted with as opposed to directed.
And I think, quick comment to that point, Dr. Val, I think it is important, even as, like you said, so yes, from patient client perspective and even from provider perspective, because I'm imagining many of the providers are also seeing other providers, and it's like the same type of treatment you would want. I'm often like, yes, you should give that to patients, clients, however, because I know if someone comes into a session with me, even if I may have a list or an agenda where I'm like, oh, this is the plan. Does that work for you? Did you have something else that was a priority? And so even if you get the list, there should be that space for partnership, not this is what we're doing. And it's
Yeah.
like, but I actually came in with a different concern. No, this is what we're doing. That's crazy.
No,
That is,
it can't be,
it's
right?
crazy.
It can't be what we're doing, right? That is
No,
crazy. It
because
can't be
that's
what
not what I came to do.
Mm-mm, mm-mm. Exactly. And I love what you said. It's a partnership. We've got a few P's later on in the program where we give you kind of a list. So I like what you said, partnership. Um, yeah. And then, the thing about it is, as a mom, as someone who is birthing, you really want to feel supported because that nervous system, the calmer it is, the better. Studies have shown that labor is in a shorter duration, pushing shorter duration, better outcomes for mom and baby postpartum, when your nervous system is calmer, when your nervous system is more relaxed. And so you think about the impact on emotions and also the physical body. The body tenses up when we're not feeling calm, when we're not feeling relaxed. That can lead to a plethora of other issues. But think about, for example, pain, right? Pain can come on when we are feeling, stressed and tense, our muscles tense up. It can remind us of things that are unpleasant, again, causing that nervous system to kind of be disrupted a bit. And so, honestly, it is so, so, so important to make sure that you feel comfortable with the provider. If you choose a provider, it's important that you feel comfortable with that provider who is going to be helping you with the delivery of the baby. So,
Yes, Val, because just like relaxation can help move things faster, we know that stress response can make labor slower, and
correct.
we don't want that. We don't want that. Get yourself
Mm-mm.
someone who listens, explains, and validates. So you want to
Correct.
feel safe and heard.
Absolutely. Absolutely. All right, so we have a little bit of a framework for you guys so you can remember what you're looking for in a provider. 4 P's. So here we go.
So, since we had already kicked off with partnership, or we had mentioned partnership earlier, think about if when you go to the provider, do they ask you what your goals are, what your preferences are? I know some people might ask early on, some people might ask midway through, some people might ask towards the end. I know it definitely varies because I'll have some people come into the office and say, "This is what I want." Other people come in and are like, "I don't know what to expect at all." So then there's a conversation of, well, these are the things that are available. Do you have certain goals now? And even sometimes I'm like, many people, their goals look like this, or some people have goals like this, just to give people options of what to work with. And so it's a partnership, not these are the options. You're gonna do this one. That is not partnership.
No.
And even considering the language. So what feels best? Or let's explore together. What are we doing? Not you or
Yeah.
me.
Absolutely. It's what are we doing? What are your goals? What feels good to you? People should be asking these questions of their patients. And it's because, again, I feel like with the word partnership, it doesn't often come up with providers, but think about your partnerships with your spouse or your life partner or your boyfriend, girlfriend, whomever, even your friends. Think about other
Mm-hmm.
partnerships, business partners. Think about those relationships. Would it ever be one-sided? Mm,
Yes. Is there going to have to be a power differential? Just because someone has the additional knowledge does not mean, oh, I am the end all be all. It's like that knowledge should be shared, and
mhm.
then we can make a collective decision on what works. I love that you said, what do you think about business partners? Yes, relational partners, whether friends, romantic, what have you, like it's not a one sided, you do this.
Yeah, exactly,
Yes,
exactly,
yes, yes, yes.
exactly. Yeah,
That's such a good
love it,
point.
love it. So then thinking about, okay, you've got this partnership with this provider. Think about also too, if you're choosing to give birth in a hospital setting or a birthing center, wherever, think about the policies. And when we say policies, okay, well, let's time out for just a second and just acknowledge the fact that policies and structures and systems have historically been put in place in a very in a way that promotes health disparities, in a way that um, promotes either unintentionally or intentionally poor outcomes for people of color. So, thinking about that, let's talk about policies. So, a lot of times people, we'll have clients that come to us and say, well, I was told that I need to be induced. And Dr.
Mm,
Saiah and I
you don't
can go
have
on a
strong feelings on
diatribe.
induction.
Dr. Saiah and I can go on a diatribe about inductions. And we do teach people, when inductions we give information, we give knowledge about inductions and
And
rates
how to
as to
advocate for
and how to
yourself.
advocate for yourself. But these things happen, right? Where we have clients coming to us saying, "Well, I've been told that I have to have an induction." Okay, our next question is, tell me what the rationale was. Tell me why.
Yes. What is the reasoning?
What is the reasoning? You guys would be surprised. Think about it. There are actually, you can look this up, there are less births on holidays, Thanksgiving, Christmas, 4th of July. Why? Right? And we're going to leave that there. But when you're thinking about these hospital policies, you want to
Yeah.
say, okay, so with the case of being induced, do I need to be induced because this is a hospital policy as to where if I'm presenting like X, Y, and Z, then you go towards induction? What are the reasons? Or is it a provider preference? Does the provider
Mm-hmm.
prefer this thing to happen? Same thing with mobility in labor. So I'll give
Mm-hmm.
myself for an example. When I was delivering my daughter, I chose to have an epidural, and when I was on the epidural, I had the catheter, and I remember one of the nurses said, "Okay, well, you're gonna have to be here on your back. You know, you can't move." And I was like, "Oh, you don't know. I'm a physical therapist. I feel very confident and capable of moving." She was like, "Well, I don't know because I really don't want you to hurt yourself." And so then as she's saying these things, I'm realizing like, okay, this is not a hospital policy, first of all. Second of all, this is her preference. She prefers me not to move because it is a liability in case I hurt myself, injure myself, whatever the case may be. But I said,
Oh.
well, I can move my legs, and I was showing her like, look, see, I can move my legs. I do have some core strength here, so I
Mm-hmm.
can get into all fours. I said, so please, would you bring me a physio ball? And I had to ask her a few times to bring this ball, but she did bring it, and I got on all fours, and I was on my
She did.
bed
She
moving.
brought it.
But that's the thing is I knew that as as someone who preaches and teaches movement all day, I knew that I was capable of moving in that
Safely.
safely moving in that situation. Now, is that going to be everybody's situation? No. I'm not saying if you're out there with epidurals be moving around. No, 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 no. But
In
what
some
I'm saying
cases.
is, yeah, in some cases, you know your body, know your options, right? So yeah, that's what I'll say on that.
To that point, I do like to tell a lot of my mamas who are preparing for labor and delivery, like we'll go through and it's like, hey, these are positions you can try. These are the reasons why you would try certain positions. I'm also like, please take this sheet because we'll practice. We'll say, what's your favorites? Okay,
Hmm.
these are your favorites. Please take this sheet to your birthing provider and say, these are my preferences. Is there any foreseeable limitation in me doing this? This is my care plan. Is there any foreseeable limitations? That way, ideally, before you even get to the room,
Yes.
you have already talked about it and said, this is my preference. And so that way, if some other person shows up to this birthing process, you have already talked through and said, oh no, I have been told and have thoroughly discussed. These are my options. So it's not like, oh,
Yep.
well, your preference today is this. It's like, these are my
Yep.
options unless something new or strange out of the woodworks has come up. And
That's
so
right.
I love the self advocacy vow because I think it can be an intimidating space when it's like, oh, this person's the expert. So they're going to tell me what's best for me. And I'm like, you,
Yeah.
I love to say, yes, there is a trust in the medical system, but also there's a trust in self advocacy and partner decision making. So I'm always like, make sure you know as many options and ask all the questions because you know what? It is our job as practitioners to answer your questions and make sure you are as aware as possible.
All the time.
Um, and so, yeah, I like that you push the envelope. This is why I do love mentioning doulas and alternate support persons in the room. Because I'm like, sometimes you're busy trying to
Yeah.
get tiny one out or tiny two,
Absolutely.
tiny
Yep.
three, however many people are coming out. You're
Yep.
trying to get them out. So we need that support person to be like, know what the plan was,
Absolutely.
actually.
especially
Is this?
towards the end of labor and towards the actual pushing and you
Yeah.
go into this almost catatonic state where it's and it's physiological, it's natural to go into the state where the birthing person turns inward, and in that time it is so important to have someone who is advocating, you know, that's definitely something that is helpful so that you don't have to come out of that state as the birthing person, so that you can stay inward and focus on delivering the baby or babies. But yes, to your point, absolutely, say it, that's so true.
Yeah, stay in the zone. And my last comment on policies, like yes, some policies are really there for health and wellness.
Mm-hmm.
However, there are the policies that might be influenced by insurance and
Mm-hmm.
liability, like you mentioned, and some policies that do, like you said, affect or promote disparities. And so it is really good to be as aware as possible. And definitely for our mommies of color, it's gonna be that extra push for advocacy. I'm like, all women definitely, but the mommies of color, we need you to be on the lookout and know what the red flags are. So don't be afraid to ask about induction rates, cesarean rates. If you want monitoring, if you don't understand what something is, it does not make you dumb. It does not make you ignorant. Ask the
Mm-hmm.
question,
Mm-hmm.
get the answers, ask if there's other options, if there are not options provided to you, and what that looks like. I'm like,
Absolutely.
ask as much on the front end as possible.
Mm-hmm. Absolutely. Agreed, agreed.
Speaking of, or shifting to our next P number three, presence and
Mm.
manner.
Mm-hmm.
Is your provider, are they calm? Are they kind? Are they reassuring? I had someone come in. One of my mommies came in. She was like, anytime I ask a question, they make me feel like I'm dumb, like I shouldn't have asked. I was like, that is not anything you want to see in a provider. No, no. They should be reassuring. If they're rushing you, if people are dismissive, if people are condescending, no, no, no. That's a no go in the birthing or
Mm-hmm.
alternate space.
Yeah, absolutely. You want someone who is going to not shut you down and make you feel silly for asking a question. You're not silly at all. You want to be informed, and there is nothing wrong with that at all.
Yes.
Even the smallest of questions. Because I will say, at the first, as soon as we got into PT school, they said you are going to be learning a new language, and I was like, "Tell me more." And they were like, truly medical language. That's what you're going to be learning, and it's a whole different language. And it is like the way that Saiah and I would talk to each other is not the way that we would talk to our patient about things, just because the jargon can be overwhelming and it can be a lot.
So overwhelming.
It's so overwhelming. It's so overwhelming. So making sure that you understand, because your provider, maybe they slipped up and said a word that's a medical term, and maybe
Mm-hmm.
they meant to say something else. Ask the question. Ask the question. So yeah, and their presence and their manner should feel calming, soothing, comforting to you. And that's going to be different for every person. You know,
Mm-hmm.
there are people like Lisa and I, our other partner in the Balanced Mama Project, I think sometimes we both are like, just say the thing, right? Just like say the thing, be direct, say the thing, right? So to that point, you know, my provider, who I chose to help with the birthing process, I mean, she's a very direct person. She's a very, I'm gonna say it like it is. I'm gonna tell you how it is type of person. But I like that. I need that. It's kind of comforting to me because it doesn't make me have to wonder or guess. That's how I roll. But she never made me feel like I was rushed, or she never dismissed me. So those two things can be different too. People can be direct,
Mm-hmm.
but not, dismissive, if that makes sense.
I love that you said that. The directness can be helpful because, like, oh no, there is no guessing game. This is what it is. Okay, now I can make my decision based on what the facts are.
Hmm.
Like, I can live with that.
Hmm.
Um, and then even looking at, oh, side note, I'm
Hmm.
like, as many questions as I will ask at a restaurant, and don't let me tell you, if I go to an Italian restaurant, do you know how many questions I ask about what is this on the menu? I know for the birthing process. You should feel just as free. I don't know if you're a restaurant question asker, but your girl is. I got it from my dad,
I
honestly.
am
But I'm like,
too.
well, what is that? Well, what does it
Yes.
taste like? Well, which one is better? Well, what's your opinion? Okay, now let me think
Go
of what
for
my
it.
opinion is.
Yeah.
And so I'm like the same way. You may go to a restaurant or you may ask questions finding a product you should have, even
Yes.
more or not should.
Yes.
But you can feel free to have just as much investment in asking
Yes.
about your personal birthing process. All
Yes.
the questions.
I love that so much. I am 100% that person who goes to the store. Like, I'll go to Sephora and I'll be like, yes, excuse me, I'm looking for this. It can be right in my face, but I'll be like, well, what do you think about it? How many people get this? Do,
Can
do
I
they
try
like
it real
it or do
quick?
they bring it back? Like, can I get, I'm
Let
asking
me
all the
ask.
questions.
Let's get into the question game. And even with those questions, is your provider making eye contact? Or sometimes it's the eye contact type. I know I'll be like, okay, what you saying?
Mhm.
Do they listen without interrupting you? Or if they're interrupting, at least getting a clarifying question in, just to clarify. And are you getting explanations that are clear and not more murky or elusive? It depends is fine only if there is what does it depend on
Yeah,
after the it depends. It's like,
yeah.
okay, that may
And
differ.
and
What does it
sometimes
look like?
exactly, and sometimes a provider, it's okay for a provider to say, I don't know.
Yes.
Because
Yeah,
you
it
think
is.
about it, we're not robots. We're not AI. And trust me, you don't, I mean, maybe you do want an AI doctor, but
Not all
I
day.
personally, I'm not ready for that. But we don't know every single thing that we don't know the answer to every single thing. So it is okay for a provider to say, I'm not sure about that yet. Let me get back to you. I'm gonna do a little bit more research and I'll get back to you. Right. So if the explanations are getting a bit murky or it seems a little bit weird, you're not clear on it, don't walk away with an unknown.
Correct.
You have
Get the
your,
clarity.
yes, your pen and paper is there. You should be able to say it back to someone else. And this is something that we also advocate for our clients is have someone in the sessions with you, in the visits with you, if
Yes,
possible, even
if you
if they're
can
on
do.
FaceTime or a phone call, have them there so that you have another set of ears listening because sometimes it can also be overwhelming to be listening and taking it in and they're talking about
Hmm.
you at the same time.
That's correct. That's a really good point. And I like that you emphasize it doesn't have to be in person. They can be via video. They can be via phone. As long as you have someone else. It's like, all right, did you get what I missed? Yes.
Yep, absolutely. And then, so our final fourth P is postpartum continuity. So, what that means is just what's going to happen after you have the baby, right? So, ask what your follow up care is going to look like. So, for some people, it is for a particular provider that they've chosen, you are followed up with in 6 weeks, right? For some,
Hmm.
for other providers who might see you more frequently, be it a midwife, a doula, a physical therapist, you
But
might be
we're,
seen sooner rather than 6 weeks. So it really just depends. And are you going to be so setting yourself up before delivery is so important for your successful recovery post delivery. So do they support the whole you? I can't emphasize this enough because a lot of times birthing providers will focus very heavily on the physical aspect. And while that is very, very important, you are a whole person. So, are
hmm
you also going to be followed up with emotionally? Do you
yeah.
need to set up something with your therapist, for example, for 2 weeks postpartum or whatever the case
Yes.
may be?
Consider it.
Consider
Consider
heavily,
it strongly.
heavily consider it.
Consider
Make
it.
sure that you have your people set up, all right, for postpartum. So just remember in all of this that with your provider, you're this is you interviewing them, right? Just as much as they are checking you out, evaluating you, you are also interviewing them to see if it's a good fit. Listen to your intuition, trust your gut. If you leave an appointment and you're feeling anxious or nervous or worried or disappointed, or not even disappointed, because sometimes things don't happen the way that we want
As
them to happen,
planned.
right?
That's true.
But if you're confused, it's quite all right to not only seek a second opinion, but we are of the mindset it is okay to change providers. Okay, not everybody is going to be a good fit. It really is
That's
true. Not
true.
everybody's going to be, not everyone is for you. So,
Yes. I've had mamas change up into their 30 some weeks. And people
yeah.
were like, I don't know if it's too late. Someone just told me that. And they were like, maybe, what were they, 20 weeks? I was like, no, ma'am, it's okay. If you're thinking about it, it might be a good time. It might be a good
Mm-hmm.
time. But
Mm-hmm.
that's such a good point. And
Yeah.
yes, I agree on the pre-setup. Even if you were thinking about pelvic PT, if you had issues before or concerns, maybe set that up in advance. I know Dr. Lisa was telling me that it was the struggle to find a pelvic PT who had availability sooner than 6 months. It's like for some of these things, if you wait till after, not that it can't be done, but sometimes there's a longer wait time. So
Mm-hmm.
when it comes to counseling, physical therapy, some people even occupational therapy. Just yeah, think about and I don't want to overwhelm you. But if it comes to mind as a potential need, don't hesitate. It's not too early to plan it.
Yeah. For sure.
Um and to the point of the interviews and that self-awareness of if you're anxious or confused, like notice how you feel, but we do need to know ourselves, like what type of environment and what personalities, bedside manner makes me or allows me to feel safe. What
Mm-hmm.
allows me to feel relaxed? Do I like low lighting? Do I like hype music? Do I like mellow music? Y'all, I like mellow music any time of the day. I know I be putting people to sleep on these drives. That's why I gotta let other people play
Do
the music and
a
pick the
little
radio.
Luther, a little Cleo soul.
Peaceful. Peaceful. I'm trying to be peaceful all the time. Think about how do you like to receive information? Do you prefer more of an emotional support? Because sometimes that is the case. It's like I just want to be reassured that
Yeah. Hold my
my
hand.
decision is an appropriate decision. That's it. I love to hold my hand. Love it.
Mm-hmm.
Or do I like data? Numbers. I have a friend, she and her husband, they're both engineers. They're like, I want to know the numbers. I want to know this. I say, yo, y'all don't care about the emotional support. You just want the facts and the figures. If you know that, you're like, I'm good. I can make my decision. And if you like a little of both, that's fine too. If you're not getting it, you can request like, hey, well, what are the numbers? Or
Yeah.
hey, actually, I'm just looking for that handhold because that's just
Yeah.
fine. Um, and then some other things to consider. I was talking to a mama last week and I was like, what's your birthday plan? She's like, I'm gonna show up at the hospital, I'm gonna have the baby. I said, do you know you have more options? I was like who do you want in the room? I was like, do you want your partner in the room? She had mentioned her mom was coming to visit. I said, do you want your mom? Yo, she lit up so much. She was like, my mom can be there. I said,
Oh.
I'm pretty sure your mom can be there. You can talk to your team to double check. But if mama's gonna make you feel safe and supported, she was like, yes, yes, she will. I said,
Yeah.
then you might want to start discussing the plan to bring mom into the birthing space. So whether it's partner, I know she was so cute. She was so
That's
hyped.
so
When I
cute.
say I never saw enthusiasm like that from her, she was real hyped. Then I was hyped for her because I said, oh, that's the sweet spot.
Right, right. I hope she comes.
But I know. You can bring friends.
Mm-hmm.
Doula. If you don't want anybody, one mom was like, I just want me because it's going to stress me out to have anybody else. Okay, that's
All right.
fine. You
Yeah.
know you know what works for
And
you.
you know your people. So,
You do know your people. You said, I will see you afterwards when I look
uh-huh.
like a champ, and that's just
Mhm.
fine.
That's fine.
And don't let people guilt you being like, but I thought I would. No, no.
No,
This is your birthing
this is your
experience. It's only what you thought. Oh,
exact.
Dr. Val knows best. You
It, it's so true. It's so true. What you say goes. Take advantage of it. This is almost the one time in life where you get to be the most selfish, right? Like in the best way possible. You get to decide who you want to be there. And my my husband and I talked about it and we were like, okay, it's going to be us in the room and it's going to be great. And then we knew that my mom was going to visit and I said, yeah, my mom's going to be here for support, afterward. But then as the day came and as, things started happening, I said, well, I don't know, my mom could be in the room. And
she
at
could
first
come
my
in if she
husband was
wants to.
like, right. My husband was like, but, but it's supposed to be me. And I was like, oh, wait a minute. Remember who is giving this birth? Who is
Who
doing
is it?
this thing? And it ended up being beautiful. It was both of them in the room, and it was very sweet. But I had my spouse, and I had my mama. I had
I
both.
love it.
So
You said the
you
best of
can
both
have,
worlds.
yes, and you can have who you need to have. You can have who you need to have. Yes,
Yes.
absolutely.
That's my boundaries, girl. I love it. And
Mhm.
so, even knowing what are your strong preferences. So, are you like, and so when I say must haves, yes, there are different scenarios where things do not always go as planned.
Mhm.
But it is important to not only know your strong preferences, but to convey it to your team. I would love to say when they ask or before they ask, I'm more of a whether they ask or not, these are my strong preferences. But based
Yes.
on our statements from before, my hope is that you will indeed be asked what your strong preferences are or what your, if you have preferences.
Mhm.
And so, yes, whether it's skin to skin, whether you want to do movement, whether it's opinion on cord clamping, what's going on with the placenta overall, it's
Mhm.
just take time to think about if you have strong preferences. And if you don't, okay, that's okay. You don't have to. But if you do, then just make it known. When you know your needs, then you can find a provider that complements the needs. Not someone who's like, you got to do this or you got to do that. It's much easier to make the partnership happen.
Yeah, absolutely, absolutely. So let's, now that we've gotten through the four P's, I really do want to talk about relaxation and it why it's a major key in labor and delivery. So, you know us, we are all about the nervous system, right? We are all about that foundation of being able to calm the nervous system. And one of the reasons for that, especially during delivery, is because that nervous system being in a rest and digest state for the majority of the delivery is going to bring about this sense and this feeling of safety. And so, physiologically, in our bodies, we produce this hormone called oxytocin. That's our like happy hormone.
It's so cozy.
It's so cozy. It's like speaking of cozy, like oxytocin comes on when you like see someone you love smile back at you, or you have that like nice cozy warm cup of coffee or tea in the dead of winter, and it just feels like it's warming your entire soul. Oxytocin is being produced, right? That is going to lead to more efficient contractions. When I say efficient, I mean a contraction that produces movement and opening of the pelvis and widening of the cervix so that baby can come through. So you it's so important for effective and positive outcomes to be able to have that rest and digest, that calm nervous system activated. So things like breath work, very good. And we're not talking about no, I'm not talking
Oh, I
about deep.
know.
We're not talking
I'm
about
not
that
gonna
type of
hate
breath.
on it. I'm not gonna hate
I
on
don't
it,
know
but
what
yes,
y'all were doing in the 90s, but it's that's not it. We're not talking about that breath work. Dr. Say
then
and I can take you.
hyperventilated.
Yes, Dr. Saiah and I can take you through it, but it's really that deep belly breathing. It's really that blowing out the candle,
The
inhaling the
humming, the
flowers,
hums.
the humming, the haws, and loose. So I love that you said that, Saiah, because the reason why, especially during labor and delivery, we want you to vocalize is because you're really loosening up the vocal cords, and there's a correlation between loosening up the throat, the vocal cords, and things, and loosening up or relaxing the pelvic floor. So they
Mm-hmm.
go hand in hand. So having like a soft jaw can also lead to a soft pelvic floor. So we want you, and it also, in addition to it, oh my gosh, there's so many different benefits, but I'll make this brief.
I know,
Also,
Dr. Val. I say
I
you ready,
know,
ready.
I know. It's like the humming and the hawing and all of those things. Those are also soothing to the body. You think about like a kid, oftentimes will just like kind of hum to themselves, rock a little bit, sway a little bit. All of that is also activating that calming nervous system. And then movement as you are able, as you're physically able to do, movement during labor is also super, super helpful for you in terms of relaxing yourself. And then um, think about your provider in terms of how they are going to promote your relaxation during labor and delivery. So, what I mean by that is, do you have a provider whose base volume is on 10? Because
Ah,
maybe maybe that's not necessarily the volume that you're looking for. Do they are they able to vary their tone of voice? Do they have a patient and calm demeanor? And what does the environment look like? Is the environment going to be um, give you this sense of threat, or is this environment going to give you this sense of peace? So those are some things to think about. And then we want to kind of get into the red flags as well.
oh, I'm glad that you mentioned the tone of voice. It's so funny because tone of voice is it is a learned thing. Like you don't talk on 10 for everything. If you're cheerleading, it looks like one thing. Rooting for your team looks like one thing. If you're whispering a secret, that sounds different. If you're teaching a yoga class, that sounds different. There are so
Different.
many tones for
Mm-hmm.
different portions of life.
Mm-hmm.
But you had summed it up well. So, quick note on the red flags to watch out for. If you feel dismissed or rushed, or it seems like each appointment you're not getting your questions answered, it's a talking session, the session is over, you're moved out of the room because your allotted time is wrapped up.
Mm-hmm.
That is a red flag. It is something to I say I don't want to increase concern, but that is something to be like, hey, something needs to change. I can't continue to come to appointments and not get any questions answered, and also still not have learned more than
Mm-hmm.
before I arrived. Because why am I here?
Right. Exactly.
Frequent declining of requests, especially without explanation or additional options. If you're like, hey, I'd say my person brings in their birthing packet. I thought I was going to get in. These positions are my favorite. And the answer is no. And it's just no. It's like, well, but what's the reasoning? Is there a reasoning? Is it a safety issue? What, what are my other options if I can't get on my all fours?
Mm-hmm.
Then can I roll? What is limiting my options? And then what are my other options?
Right.
If the answer is, oh, I've even heard different induction stories, different things. But if the answer is no, but these are your other options, or no, this is why, or even, okay, that can be considered, but also,
Right.
can we consider this? Or if it's just yes, we're going to keep it moving. But yes, if it's a flat no, no explanation, and it's just like I'm running things, that is a concern.
Mm-hmm.
And then if there's no discussion of informed consent. And so when we say informed consent, you did not have to. I'm like, I didn't go to school to be a chef, so I don't expect to know everything about food. I'm not a car mechanic, so do I know all the things about cars? No, I actually know very little. So when I go to a restaurant, when I go to the car shop, I do expect a certain level of explanation of what is going on. And so for the medical world, there should be a certain level of explanation. Okay, this is what your body's going to be doing.
Mm-hmm.
These are
Mm-hmm.
potential options that can come up. And so, even beyond C section, when we talk about instrument assisted, we talk about forceps, vacuums, just knowing possibilities. Not saying any of these things will come up, but if something should come up, it is helpful to know, oh, so that you can say yes or no. That is something I would be okay with if
Yeah.
it felt like a necessary procedure where you can think about it beforehand.
And
Uh,
also with that,
Go
with
ahead.
informed consent, I want to note that it's not the provider's opinions or fears or concerns that are baked into the information that you're getting. So
That's
when
true.
we say informed consent, if your options are vaginal delivery or cesarean section and you all are trying to decide between those two options, it should be that the doctor, the provider, whoever the provider is saying, well, this is how you're presenting, and usually, typically, we see this percentage of outcomes go this way and this percentage of outcomes go this way. They're giving you information. It should be factual
I
information
love that.
as
Yes.
opposed to them saying, I think you should go this way because I don't know if you can really blah blah blah. No, 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 no. It should
Yes.
only be facts.
The I don't know if you can. You're right. It's a fact or it's not a fact. It's not a
Hmm.
what
Hmm.
you're saying what you think I can or yeah. That's a whole different tangent. Yes. Facts are important because yes, I even talk about preferences. It's like, yes, you can often move. I know the preference might be that you're lying on the back sometimes because that's a better view
Yeah.
for medical staffing. However, you have other options.
You do. You do. You definitely do.
And with that point, pressure. Pressure to either feel like you have to rush to make a decision, especially in these appointments leading up to the birthing process, or pressure to feel like you got to do this now, or you have to do it this way, or you're not going to be supported. Because I have even had a patient come in and mention, I felt like I was going to be punished for choosing the way I wanted to choose. And I was like, that's
Mm.
not a feeling. It shouldn't feel like vengeance. Oh, you chose or you prefer, like you as the patient preferred a certain way, and now you're not going to be supported because you chose that.
Right.
So no, pressure is not a thing that we welcome either. And then if there's no postpartum follow-up plan, someone should be following up.
Yeah.
I'm like, as much care as you get prenatal, I'm always like, keep that same energy because
Keep
it
that
is
energy.
still, it is still a section of life where you are recovering and there are health risks that can come up. We don't love to see them, but you should be monitored to make sure no scaries. I'm always like, no scaries, because I'll do 3 week postpartum follow ups. Our occupational therapist will do 2 week postpartum follow ups. It's like, no scaries, nothing strange. Even when being released, if released from a birthing center, from a hospital, we don't want to see any scaries. If
No.
it feels off, get an opinion. If it
Mhm.
still feels off, get another opinion. It's going to be the aggressive advocacy for some. I hope that it will not have to be, but
Yes.
please do, even
Absolutely.
postpartum. And
Yes.
so I think that was my summary. Val, I'm sure you have a little more to say, or a bit more.
Yes, yes. Well,
Dr.
so
Val,
I
pardon.
guess I will just, I know we listen, we're on first name basis, obviously, and so are our listeners. It's all good. So, yeah, what I will say though is just to summarize, we we really want you to know that it's not about perfection, and also your provider, you may say that, okay, two of the P's that they talked about I really care about, the other two P's I don't care about. That's okay.
It
That's
is.
it's gonna be person dependent, but we want you to feel aligned. At the very least, we want you to feel aligned with your provider who you choose to help you through this particular momentous occasion. And so you deserve to feel that you are safe, and you deserve to feel that your care is gentle and that it is collaborative. And if it's none of those things,
Mm-mm.
you are feel free to switch it up. Feel free
Yes, ma'am.
to change it up. Okay? You have our permission. And so, we are so grateful that you stayed with us today to hear all about labor and delivery prep and looking for a provider, what to look for in a provider. We welcome you back for our next episode with the Balanced Mama Project Radio. Stay balanced, mamas. We love you guys. Bye.
Bye, gang.